They're scared. They don't have enough confidence in their skill set. They don't think they know enough to make decisions. They're fine in giving advice. They're fine in counting pills. But if you ask me to make a decision based on my clinical assessment, I don't know that I have enough skill to do that. We've looked a lot at this gap of knowledge. In fact, I will tell you that the presentation and the slides that you've just seen is the same slides that we just finished sharing with the faculty at UBC and the student body at UBC. We need changes in our profession to ensure our practitioners have the skill set to do the job that they need to be doing. And it's a problem. The gap that we've discovered, it's not in the technical aspects of the job. They know the technical aspects of the job. They know pharmacology better than any healthcare practitioner knows pharmacology. It's applying what they know in clinical decision making. That's where they're challenged. That's what's holding them back. I don't know that I know enough, right? It's they don't know enough to know what they don't know. They know what they know, but they don't know enough to know what they don't know. It sounds like a kind of stupid statement, but if you think about it for a minute, it makes a lot of sense. And it's a huge barrier. And we need to move pharmacists from counters to counselors, from giving advice to making decisions. And education is a huge barrier. So we are looking at, just as Dr. Carr was alluding to, we are seriously looking at our entry to practice standard. We have zero interest in moving that standard in any direction other than up, right? We have a lack of knowledge, not an abundance of knowledge, right? I can tell you that in the United States, they have, within the last 2 years, moved from what would be the equivalent to of a 4-year baccalaureate to a 5 to 6 year entry-level doctorate as their entry to practice standard nationally. Quebec in this country already has that as their standard, and all other provinces are looking to raise our entry to practice standard to meet that. Currently, we have a 4-year baccalaureate standard for pharmacists in BC, and we know there's gaps. So when we look at our entry to practice, because I know that that's something that this profession is struggling with, I thought this might be helpful if I could walk through a model with you, and I'll do it as quickly as I can and try to stay with me because it's a bit complex. The reason that I know anything about entry to practice standards is because, as I said, we are regulating pharmacy technicians. So we have are in the process nationally of creating a whole new healthcare professional. To do that, you have to establish an entry to practice standard. And there is a process, right? There's a way that you do that. You don't just pull it out of the hat. You don't magically say, I think that this is what they should have to learn. There's a process. And it starts with, what is the scope of practice for that professional? This is probably the most important thing. What a scope of practice is nothing more but nothing less than the job description. What's their job? What do you want them to do? What's the job of an RMT? What's their job? You got to understand what the role is that you want that practitioner to play as an individual and within the healthcare team. What's your job? Based on what your job is, you develop competencies and learning outcomes. There's a slight difference between the two, but they're both based on starting with competencies. Competencies are nothing more than what are the skills that somebody needs to do the job. Everything relates to what is the job that you want that individual to do. So what's important about a competency is how robust is the competency. Example, a competency statement could say you need to have a basic knowledge of pharmacology. That's a competency. The competency could also say you need to have an in-depth knowledge of pharmacology and the ability to demonstrate the application of that knowledge in clinical decision making. That's also a competency. Both competencies are about pharmacology. What we'll get to in a second is one of them probably means that you take one term in pharmacology, basic pharmacology 101, and the other probably requires that you take 4 years of pharmacology at pretty advanced levels, right? So that's what competencies are. It's skills, but the words matter because the words are what dictate how robust that competency is. A learning outcome is only a competency expressed as what does it look like if somebody can demonstrate that they have that skill, right? That's what a learning outcome is. That's why I put them on the same line. They're really just a different expression of the same thing. To remember, so let me get back to competencies and curriculum hours for a second. There are two components, separate components, of the same and related process. So you can say that competencies don't have hours, fine, you can say that. But competencies will get expressed in curriculum hours. It's impossible to say that they won't result in that. And the more robust your competency is, the more education is going to be required in order to meet it. Until somebody figures out how I can inject knowledge into you, the only way that I know that you actually learn it is you have to spend time doing it and learning it, right? So if you're required to know more, it's going to take you longer to know it. It's kind of simple. So they may be two separate components, but there absolutely is a relationship. There's no doubt about it. The other thing to remember about entry to practice, and this is critical, entry to practice is not setting a standard that's like minimum. Entry to practice standard is the standard that says, when you graduate and have met that standard, you have the skills, knowledge, and abilities to practice to the full extent of your scope. You can do the entire job that is being asked of you. Whether you actually do that when you get out of practice and practice in the real world is irrelevant. We have pharmacists that have got out and never, God help us, counseled a patient in their life. They've stood behind their pharmacy dispensary counting by fives and are going to retire counting by fives, putting their little pills in a bottle. It's sad. They are totally underutilizing their skill set. That's a different issue. The entry to practice standard absolutely has to be providing you with all the knowledge that you need to do your full scope. So I think the question that I have for you, and I'm almost done, is really, let's think about your job. Who do you want to be? Who are you as a registered massage therapist? That's what we're struggling with right now as pharmacists. And I can tell you that we want to be and are medication experts. We do not want to be known as dispensers of medication. We want to be known as a skill set that actually can direct and give appropriate drug therapy to produce better health outcomes for British Columbians. That's who we are as pharmacists. Who are you as RMTs? And whether it's a physician who's trying to think of where they're supposed to go for their patient for treatment, who are they going to refer to, or whether it's the patient themselves and that patient-centric model, thinking of who's going to be on my health team to better me, who are they thinking of? That's the question that I want to leave you with when you think about your entry to practice standard. There is a relationship between the knowledge and skill set that you have and who you are and what the job is that you do. And that, to me, is what you need to be focusing on.